Hey, Dr. John. Recently, we've had a number of clients who have suffered cervical disc herniations. Is that significant?
Yes, cervical disc herniations are very significant.
Do you have experience treating cervical disc herniations?
Yes, I've had experience evaluating, diagnosing, and treating cervical disc herniations.
Could you please explain to us what the relevant anatomy is to understand a cervical disc herniation?
In order to understand a cervical disc herniation, we have to first understand the normal anatomy of the cervical spine. The cervical spine is made up of 7 cervical vertebrae. The vertebrae are the bones that kind of support the neck. If we look at this slide, we can see the structures that are involved in the cervical spine. Those structures include the vertebral body, the intervertebral discs, and adjacent to them, the spinal nerves.
What's the function of those cervical discs?
The cervical discs that are between the vertebral bodies that act as shock absorbers. So the cervical spine actually is involved with keeping the neck upright, as well as allowing motion in multiple directions. When the motion occurs, the discs allow a fluid motion and allows cushioning when forces are applied to it.
How is the anatomy affected if one of our clients suffers a cervical disc herniation?
In order to understand a cervical disc herniation, we're going to take a look at another slide. On this slide, we're looking at 2 different views of the cervical spine anatomy. One is looking at the spine from the top, so if we were looking right down the top of the spine, and the other is looking at it from the side. On the left side, we see what's called a normal disc, and basically the disc stays right between the vertebral body without any kind of outpouching or herniation. On the slide to the right, both on the superior view and on the side view, you can see where the disc has kind of punched out, or the red part has moved out and herniated into an area where the spinal nerve actually runs. One way to think about a herniated disc is the disc is just like a jelly donut. On the inside is something called a nucleus pulposus, which represents the jelly. On the outside, there's a structure called the annulus, which represents the outer part of the donut. When too much force is applied to the annulus, a disc herniation can occur.
When our clients suffer a cervical disc herniation, what kinds of symptoms can they expect to experience?
Symptoms from a cervical disc herniation can range from simple pain or actually pain or symptoms that travel down the arm. The symptoms that travel down the arm is determined by how much the disc presses on the nerve and what parts of the nerve are pinched. In other words, the nerve can supply sensation, so it can cause numbness if that part of the nerve is pinched. It also supplies motor or muscle function. So if that part of the nerve is pinched, then you can actually get weakness.
Can cervical disc herniations be caused by traumatic events?
Yes, Mark. Traumatic events can certainly be involved in a cervical disc herniation. Cervical disc herniations, remember, are related to how much force is applied to the annulus, or the outer part of the disc. If more force is applied to that annulus than it can stand, then the disc herniation can occur.
How do you diagnose a cervical disc herniation?
Cervical disc herniations are diagnosed through a clinical examination. So in other words, you can determine whether there are symptoms of numbness, symptoms of weakness, or even changes in reflexes. But probably the best way to identify a herniated disc is through something called an MRI. If we take a look at this next slide, this is a slide of an MRI. And what we're looking at on the larger structure is a side view of the neck. And you can again see the vertebral bodies, and the black structures in between are the discs. When someone sustains a herniated disc, those black structures will extend beyond the vertebral bodies, and that's what's identified as the herniation.
Who are the right providers to treat a cervical disc herniation, and what kinds of treatment can they expect to have?
The providers that can best evaluate and treat herniated discs are either neurosurgeons or orthopedic surgeons. They're trained specifically in performing surgeries that can address somebody who has a herniated disc. As far as treatment options, they can range from non-operative treatment, things like physical therapy, the use of a cervical collar, all the way to the end where you can have more invasive intervention with surgical fusion.
What's a cervical fusion?
So one way to think about a cervical fusion is if we look at the next slide. In the next slide, what we see is a individual who has a cervical collar on. It's a soft collar, and it's designed to help immobilize the neck. But the thing about this cervical collar is it doesn't immobilize it perfectly. There's still some movement that's allowed. So a surgical fusion, if we now take a look at the next slide, basically involves placing fixation inside the neck so it doesn't allow movement. In this particular slide, the top X-ray demonstrates with the arrow a site where cervical disc herniation has occurred. This is also confirmed in the middle slide where the MRI again points with the red arrow, the cervical disc. On the bottom slide with the red arrow, a plate has been applied where the disc has been removed, and now a plate is holding the whole structure together, the so-called cervical fusion.
Is a cervical fusion a significant surgery?
Yes, Mark. Cervical fusions basically don't allow motion where there used to be motion. You're basically now increasing stresses above and below at both the discs and the vertebral bodies.
For our clients who have cervical disc herniations and then need a cervical fusion, what's the future hold for them?
After having undergone a cervical fusion, now there can be increased stresses above and below the site of the fusion. So potentially more cervical herniations or more degenerative changes can occur above and below that site.
Thank you, Dr. John.
Mark, you're welcome.
If you've suffered a cervical disc herniation and require a cervical fusion, call Diller Law.